Welcome back to Terms of Service. I'm CNN tech reporter Claire Duffy. There are so many digital tools out there that can help you manage and keep track of your health these days. And within that umbrella, there's a growing category of products aimed specifically at addressing women's unique health needs and filling historical gaps in health research, innovation, and access for women. These tools and services are sometimes known as FemTech, and they can provide big opportunities and benefits, but they can also come with some risks. And even for the gentlemen out there listening, today's episode will get into some important information anyone should know about protecting your health data online. To walk us through all of this, I have Bethany Corbin here with me today. Bethany is an attorney and CEO of Femme Innovation, where she advises startups, clinicians, and healthcare organizations. Hi, Bethany. Thanks for being here.
Hi, Claire. Thank you so much for having me. I'm so excited to talk about this today.
So you are a lawyer by training, and like many women, your introduction to the FemTech space was through personal experience. Would you be open to telling us just a little bit about your journey into this space?
Of course. I'm always happy to discuss it. So I am a healthcare lawyer by background. I've been a healthcare lawyer for more than a decade. And very unexpectedly in 2021, I was thrust into the position of patient instead of lawyer and advocate. During a routine annual physical, it was discovered that I had a large mass in my abdomen, making me the equivalent of 6 months pregnant. It turned out after emergency OBGYN appointments, blood work, testing, scans, that I had not only a large fibroid that was about the size of a cantaloupe in my stomach, but I had 5 more that were the size of golf balls, and it was crushing my internal organs. So all of that was very unfortunate, and especially for somebody who is a healthcare advocate, I didn't realize how often I had been dismissing and minimizing my own symptoms during this journey. So that is kind of what got me into FemTech. And as I was sitting there in the operating room at Mayo Clinic, it dawned on me that 80% of women have fibroids throughout their lives. There's no cure besides a hysterectomy. And if 80% of men had tumors on their reproductive organs, we would know why. We would at least understand what caused them. We would have other treatments other than removal of the reproductive organs. And that got me into thinking about how we needed much more innovation in women's healthcare than we have today.
Well, I'm so sorry that you had to go through that. That sounds really scary, but really amazing that it has led you to this place. Maybe just to zoom out a little bit, for those who may be unfamiliar, what does the term FemTech mean, and why is this such a burgeoning space right now?
So FemTech is short for female health technology, and it's really focused on the tools that are out there to help women either understand or address their healthcare problems, or also to just manage and map their healthcare symptoms. So we're talking about things here like your period tracking apps, maternal healthcare apps, and wearables. Those are going to be probably the most common ones that you've heard of, but FemTech goes so much further. So we're seeing a lot of new development in cardiac care for women, Alzheimer's and mental health care, also uterine and breast care as well. And in my opinion, what it really does is gives us a collective language to talk about women's healthcare innovation and the tools that are out there so that we can take control of our healthcare experiences and know how to advocate for ourselves in a system that's probably not been designed to advocate for us.
Well, it's so interesting, too, that you talk about heart health and Alzheimer's, like these spaces, to your earlier point, where women's health issues often present in a much different way than men's do for the same problem. And so talk a little bit more about what kinds of things it's possible for these digital health tools to track and measure, and sort of how they're helping people manage their health.
So obviously, as I mentioned, right, the ones everybody's familiar with, Clue, Glow, Flow, right, those types of women's healthcare trackers for your period and contraception, that's usually what most people are thinking about. The menstrual health space right now is about 14% of the FemTech market. And it also encompasses things like the period underwear, different types of things that are not only digital in nature, but that are also using technology in innovative ways to create women's health products. So for instance, there is a company that has created basically a smart wearable bra that you can use whenever you go for testing, like MRIs or CAT scans. That's kind of an alternative or also a supplement to the medical gown that gives patients more privacy. And what we're also seeing as well, that you've probably heard about, is going to be maternal health care. That's around about 20% of the market today. We're seeing things like different fetal monitors, different ways to track what your baby is doing inside your body. We're also seeing menopause and longevity having a real moment in the FemTech space. And that could be anything from a wearable device that manages hot flashes to new digital health companies and also telehealth companies that are popping up to create tailored solutions for women who are undergoing menopause. Some of the newer and more innovative products in my experience that are coming onto the market are relating to, for instance, cardiac health. There have been new monitors, for instance, that can be put into bras, some of which can track, your heart rate, that type of thing. And then if we look at it kind of from the cancer side, there's also a company that's developing a product that can be worn in the bras to actually continuously measure any changes in breast cancer lumps. So you can kind of see if your lump is growing, or, and kind of track that trajectory as well. The other thing we're seeing in cancer care too, we're seeing tampons coming out with new technology in them that can actually analyze the menstrual blood and tell you whether or not you have a high risk or a low risk for cervical cancer. So all of those types of things are coming out on the market. And it's really exciting to see all of the new growth and innovation that we have in this space. But oftentimes, a lot of these products, you probably haven't heard of them because of a lot of censorship that can happen online.
Talk a little bit about how these tools can contribute to women getting better health care.
There's a couple of different ways, right? So the first is just personal empowerment. So as women in the healthcare system, we're in a system that has been built historically on the male body. And so a lot of times our symptoms and illnesses are being measured against the male standard. And oftentimes, as we've learned, right, women present with different types of symptoms, et cetera, whenever they have a disease. And oftentimes they're dismissed by their healthcare providers. And that's where FemTech really comes into play, because it gives us an opportunity and a way to empower ourselves and learn more about our bodies by collecting this type of data on our own through wearables or digital health devices that are specifically made for women's bodies. And so that has been just a tremendous help. I have heard stories and interacted with patients where monitoring their period on a period tracking app has actually led them to catch cancer, where they're able to, show these changes in their bodies and take that data to their healthcare providers and show, here was my baseline normal before, here's where my baseline normal is now. And when healthcare providers have the data in their hands, it becomes a lot harder to ignore and dismiss somebody. And so you're able to get the testing that you need. So that empowerment factor for women is one aspect. The other benefit that we get as well is we are increasing the female healthcare data sets that are out there. So women were excluded from clinical trials until the 1990s. And that means that a lot of research that
so crazy. It just blows my mind. Sorry, continue.
No, it absolutely does. And because of that, we have a gender healthcare data gap where a lot of our medical research is performed on males. One of the most outrageous studies was actually a test on uterine and ovarian cancer that was done in males only. That's one of the most egregious examples out there. But because of that, right, we don't have a lot of information on the women, female body. And as a result, even companies that are building healthcare apps today are doing so on data sets that are predominantly male or might be predominantly Caucasian instead of including other racial and ethnic minority groups. And as a result, that can lead to inaccurate devices and inaccurate data. So every time that we use a FemTech device, we're actually contributing to the larger data sets that we need to train these devices and make them more accurate.
When we're talking about apps that help people manage their reproductive health, whether they are these period tracker apps or menopause apps, what kinds of data are they collecting on users? And how do they collect that data? Is it mostly just sort of self-input?
So part of it is going to depend on the purpose of the app and what data they're collecting. But if we look at it broadly, right, we're collecting demographic data, right? So we want to know your name, right, your age, where you're located, what's your email address, right, your contact information. The other type of data that you're going to unfortunately have to put into this app in order to get any type of, prediction or result is going to be your healthcare data. If you're using like a menstrual health app or something for menopause, you are most likely going to be putting information in about your height, your age, your weight, BMI, and then you're going to be putting in some pretty personal details, right? You might do start and end dates for your period. How heavy is your flow? Do you have intermittent spotting? What is your sex life like? A lot of apps are going to ask about that, especially on the period tracking side, because they also have contraception features built in. So you can try and track your ovulation and days you'll be most fertile. And as a result, right, you're going to be putting in sexual position, different types of metrics like basal body temperature, how you're feeling that day, right? And sometimes you can actually have apps that will send you like hormone collection kits that you can take and have that information added into the app as well. Some apps also have integrations where they might connect with broader healthcare apps, right? So you might have heard Apple Watch, right? Or the Oura Ring. They are starting to make connections with other types of FemTech apps and companies out there. And so if you connect that app, right, you're giving that data as well over to potentially a larger company, and also allowing it to access other health metrics about you. Maybe it's, how many steps you took that day, right? Or what you ate that day. So all of that comes into these apps and it creates a pretty personal picture of what your healthcare looks like. And also, depending on the type of app you're using, some are free and don't require payment information. And some you do have to pay for the higher tiers or even to access the app's basic features. So in that case, you're also giving them payment information, potentially insurance information if there's insurance reimbursement involved there. And then most of the apps are also going to be tracking things like your IP address. Those are going to be the main categories of data that you're seeing these apps collect across the menstrual health space as well as the menopause space.
And you sort of touched on some of this, but talk a little bit about how they use all that information in terms of the insights that you could get from that. Is it mainly like I have a better sense of what's happening with my cycle and when my period is going to come next, or the days that I'm fertile if I'm trying to conceive? Like, how are people using that information typically?
Yeah, it's very interesting, right? Because as an end user, we're putting that information in and we're expecting an end result that's going to most likely be something like a prediction, right? Oh, your fertile period is going to fall on XYZ days. Your period is going to be from X date to X date. Those types of predictions about our bodies are really what we're trying to get so that we can better understand the choices and the actions that we take during that time. As a user, that often means that we are willing to give up control of our sensitive data in order to get those predictions from an algorithm. It's very interesting to me, right, that we are willing to make that trade of such highly sensitive data because it's actually worth a lot of money. If you look at it on the black market, healthcare records actually go for almost 50 times the amount of your credit card data. And I will tell you, the majority of people do not realize that, right? And especially women, not because we're not paying attention to our healthcare data or anything like that, but because we have been neglected by the healthcare systems traditionally for so long that when tools come along that are going to help us understand our bodies, we're very eager to embrace them because we have no other alternatives and nowhere else to go. And so we oftentimes assume that a company uses our data just to provide us with those results. And that's it, right? Our data is safe and secure. And unfortunately, that's oftentimes not what happens. So your data across most apps is also going to be used to help make company improvements. And by that, I mean, it might be used to train the algorithm. It might be used to help the company come up with new products or features that they can add to that app. So there is standard uses like that a lot of us expect and anticipate. And then there's a lot of the unanticipated uses, right? One of which, and the biggest of which that causes me concern as a lawyer, is selling data. So a lot of times, if you have a free app, you need to be thinking about where that company is making money, because oftentimes they're going to be making money by selling the data that you think is nice and secure in that app down to third-party data brokers or other companies. And when that happens, your healthcare information that's really sensitive enters an ecosystem where you have no control over it.
I think that a lot of people believe that their personal health information is protected by this privacy law called HIPAA, which protects their privacy information when they're interacting with a doctor. But that's not actually applicable when it comes to many of these online services, right?
That's absolutely right. So there is a huge misconception that the same data that we give to our healthcare providers, if we put it into an app, that it's protected the same way. And I will tell you, unfortunately, in the legal system that we have in the US, that is 90% of the time not the case. The law that you're referencing, right, is the Health Insurance Portability and Accountability Act. And it actually has privacy and security rules that allow us to protect that healthcare data. But the context in which HIPAA operates is very, very narrow. And unfortunately, if we look at a lot of the healthcare apps that are out there today, they do not qualify as a covered entity for HIPAA to apply. We do have some states that have passed privacy legislation that impacts healthcare apps in the healthcare settings. Unfortunately, sometimes those laws have very high barriers to entry, meaning they might only apply if a company is making $50 million a year. These healthcare startups, right, that we're talking about here are not making $50 million a year. So those state privacy laws may or may not be applicable depending on the thresholds.
Just setting privacy aside for a second, do we know how accurate these services typically are? Like, how can people tell if they're getting good medical information?
You know, it is a fantastic question, Claire, because oftentimes as consumers, we don't know how accurate an app is. So there were studies that were done back in 2018 and 2019, so they're a little bit dated now, one of which was published in Current Research and Opinion, and it evaluated 73 menstrual apps, and it found that zero, correctly predicted ovulation. And the most accurate app in that study only had a 21% success rate.
Wow.
There was another study similar year by Columbia University Medical Center, and they looked at 108 FemTech apps and found that 95% of the free smartphone apps that were doing period tracking were inaccurate. Most of the time, especially whenever we're looking at early stage FemTech products that are just coming out on the market, a lot of them actually don't require FDA approval or validation in any way. And so what that means is it's oftentimes left to us as consumers to think about whether or not the products we're using are going to be valid and accurate for us. And so it's important as well to kind of look at the studies that they're showing on their websites to see what part of this application has been tested, what part hasn't, and is there any clinical contribution to this app? People think these apps are being created by clinicians. That's oftentimes not the case. The majority of these apps are being created by individuals with no medical background.
Interesting. That feels like a huge takeaway for people listening is like, pay attention to who is building the app that you're using. I want to talk about specifically the risks of law enforcement accessing this data. The Supreme Court's Dobbs decision in 2022 overturning Roe v. Wade, revoking the constitutional right to an abortion. And since then, we've seen law enforcement in states with abortion bans seek to use women's personal health data to enforce these laws. Talk a little bit about how the Dobbs decision has changed the calculus for women in terms of using these apps and what they need to be thinking of to make sure that their data doesn't fall into the wrong hands.
So when Dobbs came out, it was very interesting because you probably saw a flood of headlines saying, delete your period tracking apps now. Everybody was cautioning how this data could be used against you now in an environment in which there was no federal protection for abortion. There was a huge amount of fear, and hundreds of thousands of women did, in fact, delete their healthcare apps during that time. What I like to do is kind of take a step back and think about the risks that these healthcare apps pose in the broader scheme of life that we do on a daily basis. So it's interesting, right? Because we think, okay, we've given this very sensitive information to a healthcare app, and now law enforcement can access it. That's not actually typically how this is going to happen. What's most likely going to happen first is that law enforcement will be tipped off by some other technology you're using. And by that, I mean, maybe it's your Facebook messages that you're sending. Maybe it's your Google search history, right? Texts or other information that you're sending, typically from a larger technology company like Apple or Meta or Google. That type of information is a lot more accessible to law enforcement officers and a lot easier for them to get. And they're very familiar with how to get that than them going and randomly saying, I think this person is using period tracking XYZ app. Mm-hmm. So oftentimes a law enforcement officer is not going to come and say, hey, I think this person had an illegal abortion. I'm going to go and find out what FemTech app they're using and try and get their reproductive health data. what's most likely going to happen is they're going to say, hey, this person Googled how to have an illegal abortion or how to have an abortion. I'm now tipped off that maybe they're doing an illegal activity in this state. I'm going to go request their other digital records. Oh, and now I can see that they've used XYZ period tracking app. Maybe I can get those records. That's much more how we're going to see this play out. And so because of that, I always caution people to be thinking about your everyday activities that you're doing and how that might put you in jeopardy, more so than using a period tracking app. All of that being said, right, it's very important that you're choosing an app that's going to protect your privacy, not only from a law enforcement perspective, right, but from the perspective we were talking about earlier of how your data can end up downstream.
Yeah, talk a little bit about that. Like, how can people tell which apps are the safest and most secure? And how important is it to dig into the privacy policy, look at the privacy settings as you're setting these things up?
Yeah, it's funny because I'm a healthcare and privacy lawyer, right? And I will tell you, I do not read every privacy policy that I sign, and neither do you. Because if we did, right, it would take 7+ years off of our lives of sitting there and reading through privacy policies in terms of services. So I don't think it's realistic to just tell everybody to, hey, go read the privacy policy, go read the terms of service and figure it out. All of that to say, it is unfortunately largely on us as consumers to understand the different types of privacy protections and accuracy of the apps that we're using and to decide which ones we're going to support with our money. So I have actually tried to break down what you should think about when looking at a FemTech or even a healthcare app in general and what that looks like. I encourage everybody to, before you even, open your app, think about ways in which you're comfortable to have your data used. But if you're uncomfortable with having your data sold, just make a list of, what you're uncomfortable with. And then what I say is to open the privacy policy. I'm not telling you to read it all. I'm telling you to go to the sections that talk about what data they collect and how they disclose it. And you can kind of compare that to the list that you've made about what data you're comfortable giving and how you're comfortable having it be used. I also say Google the company beforehand, just to make sure that they have not had any privacy or security incidents. There are several FemTech apps out there who have unfortunately made headlines for not protecting consumer data. When we think about accuracy, learn about exactly what clinical trials they've done. What validation studies have they done? Have they even tested this product on anybody? Look at that. Oftentimes, companies that have done that want to shout that from the rooftop because it is a competitive advantage for them. The other thing I also say is while you're on their website, check and see who's part of their team. Because Claire, as we were talking about before, right? A lot of times there may not be a clinician on the team. And it doesn't mean the clinician has to be the founder or has to be, the vice president or the president of the company, but there should at least be one or more clinicians on an advisory board at a minimum for these companies. If there's not, that's a red flag to me that we may not have a clinical perspective in the development of this app.
My personal instinct here is just to not use these kinds of apps because I'm just inherently skeptical of my private health data. Going to any company as a tech reporter, I'm like, let's have as few apps total on my phone as possible. But are there reasons why you think, despite the risks that we've talked about, some of these services might be really useful to people and they should look into them?
Oh, of course. So it was interesting, right? Because whenever we had the Dobbs decision come out and there was a flood of women leaving the health tech app space, it actually harms women's health more than it helps us when that happens, because it has taken us so long to get to this place where we actually have innovation in women's healthcare and new products coming to the market. If we are not using those products, we are signaling to investors that we're not interested in them. And then we halt the funding to women's health innovation because investors are going to say this isn't a lucrative market. And women's health already gets such little funding. I don't think a lot of people kind of realize exactly how little it is. But if you exclude cancer, only 1% of biopharma projects and 2% of new medical devices are actually being given to address conditions that are specific to women. And less than 5% of global healthcare research and development funding goes to women's health. So we're already at a huge disadvantage from an innovative perspective. We have startups that want to come into this space. We have a lot of startups, and I work with them on a daily basis, that are actively trying to seek funding. And the number one question that they get from investors is, is this even a problem that women deal with? Is this something women want? And if we're seeing women's health companies not getting the, consumer and patient bases that they need to continue to grow, investors are very quickly going to look at that and they're going to mistake that fear for a lack of interest, and they're going to put their dollars elsewhere. That's also on us as consumers to make sure that we're voting with our dollars in the sense of supporting the companies that are being the most protective. Because if we do that, what we also signal to the market is that we're not going to stand back and allow women's healthcare to be taken advantage of here and just be another dollar sign. We're only going to support and invest in companies that are actively trying to make a difference and protect us, and give us products that are going to be accurate and usable.
Yeah. Well, Bethany, thank you so much for doing this. Thank you for being so open about your own story and for working in this very important space. We really appreciate it.
Thank you so much, Claire. This has been such a pleasure.